As we discussed, the Whipple procedure or pancreaticoduodenectomy, it's a very complex procedure. And that is because we need to take the head of the pancreas out. And the head of the pancreas has very intrinsic relation with the intestine, or the first part that we call duodenum, as well as with the bile duct. The bile duct is really a pipe system that brings the bile that's produced on the liver into the intestine. Now, commonly, a tumor located on the head of the pancreas will obstruct this pipe system or bile duct. And when an obstruction of the bile duct occurs, the bile gets backed up into the liver and reabsorbed in the blood, and therefore you develop jaundice, what is the yellow color of the skin. And at the same time, the stool color can become clay color because now the bile, that's the one that's responsible for the color on the stool, does not get into the intestine, and therefore the stool again turns white. Now, besides taking the head of the pancreas and the intestine and this portion of the bile duct, we need to take the gallbladder out. The reason for taking the gallbladder out is because the duodenum produces some hormones that help the gallbladder to function. Once we take the duodenum out, those hormones are not present any longer, and therefore the gallbladder doesn't function normally. At the same time, taking all of this out may impair the blood supply of the gallbladder, and therefore the gallbladder again has the risk of not receiving adequate blood supply and be ill. The gallbladder is taken out at the same time of the surgery and really doesn't have any more consequences on the patient than all the rest that we have taken out. The reconstruction is done by putting all of this back together. If we divided the pancreas here and we call this A, and we divided the bile duct and we call B, and we divided the intestine and we call C, if we take all of this out, we're going to end with this situation. The intestine is called C, the pancreas is called A, and the bile duct is B. We took this whole center part. We also divided the stomach past the area of the valve of the stomach at the first portion of the duodenum, and here we call D. This is usually helpful to be able to preserve the whole stomach. In some cases, we cannot do that because of the location of the tumor, and we need to take a part of the stomach along with the rest of the specimen. But in the majority of the patients, we're able to preserve the whole stomach. How do we reconstruct that? The intestine is the part that's movable. Therefore, we flip the intestine to approximate it to the pancreas and the bile duct. In this other drawing, we have flipped the intestine. The end that we had called C now is located here. We connect it to the pancreas, and therefore the pancreatic juices are emptied back into the intestine again. The bile duct is reconnected to the intestine a little further down the stream, and again now bile is able to empty back into the intestine. Further down the stream, we reconnect now the stomach to the intestine, and that is how food gets back into the alimentary system. Then the end result is, one more time, the food goes into the stomach, back into the intestine, pancreatic juice and bile get into the intestine here, and all get together, and you go back to have a normal absorption.